welcome to another episode of the Rise Above Cancer podcast. This is episode 5, and today I am joined by my very incredible friend, Luke. Hi, Luke.
Hi, Amy, and hi everyone. Hi, listeners. That feels funny to say that, doesn't it?
Yeah.
Thank you for thank you for inviting me on your wonderful podcast, Amy. I feel very privileged and very happy
Aw.
to be on it and be a part of it. So thank you.
Oh, you're so welcome. I'm really excited to have you on today. So currently, you're living in South Africa, which is incredible. Do you want to talk a little bit about what you're getting up to?
Yeah. So I see you deflecting the conversation away from you already. Oh, I'm gonna move it back onto you.
I just
I'm
think it's
in.
really
I live.
interesting that you're in like South Africa, hours away from me, and we're having this conversation. It's cool.
I know, right? Technology. Well, it's pretty cool, isn't it? I feel like I'm in your office with you. I'm living in Johannesburg, in Hyde Park in Johannesburg. I've been here since October, because my wife, our friend,
You're
has
incredible wife. You're amazing wife.
she's pretty amazing. She's working for the United Nations out here. She's been seconded from her law firm for a little while. So I paused my training in anaesthesia, as I'm a doctor in anaesthesia in London. So I paused my training to come out here to just live with her and just to experience Africa. And I've done a bit of work in Tanzania as well, in Zanzibar for a month, working in the hospital there,
Oh, I
which
didn't
was a
know that.
pretty awesome experience. Which was really interesting and challenging and just great in itself. And got to know some wonderful people and see some wonderful things. And then we've just been enjoying life in South Africa and exploring South Africa and
The
the countries
wildlife.
around like Namibia. Yeah, the wildlife is incredible. So it's pretty good.
I couldn't believe it when you sent me those photos the other day. It was amazing. Like you're just literally out in the wild, and there's like a pack of lions and like a couple of giraffes just chilling out while you're all there, like in your Jeep camping.
Yeah, I
Mad.
mean the wildlife is pretty amazing. I mean our wildlife is really good in Wales, but it's just a bit different to
What
just
we
to
used
drive
to.
around instead of seeing some sheep, instead of some sheep season giraffes. You gotta watch your flip flops at night as well because sometimes animals come outside your car, or you tend to need them.
Oh
I've just
no.
been today to get new flip flops actually.
Oh.
Yeah.
So how do we know each other, Luke? We are friends through, I guess,
Yeah,
my husband, Aaron, who I've been with now for nearly 12 years. Can you believe it?
12 years. Whoa,
Yeah, mad,
that's
isn't it?
amazing. Such a long
Yeah,
time. Yeah, well, like impressive.
I
You
know.
come up to 15 year. Let's have a big celebration for that
We definitely will.
then.
But yeah, so you've known Aaron, and I did ask him to double check. 21 years, which is mad. It's amazing.
Since we were 11, so first year of comp in some field comp in Port Talbot.
Whoop, whoop.
And I remember the first day where we were all introducing ourselves. We said some funny things, and we've just been friends ever since then, really. And and then I'm sure we may have maybe sort of met or maybe just been around sort of the same circles when we were growing up. But I think first properly met when you and Aaron started dating, I think, isn't it?
Yeah, I think you went to the Windsor and stuff as well, didn't you?
Yeah.
Which is
But
a
you're very
venue.
cool, Aim. I don't think I could I don't think I could come and speak to you. You're too cool for me.
Oh, shut up. But the Windsor was because it doesn't go anymore. But it was a venue that we all kind of used to hang out and go to and watch gigs and stuff when we were like, well, I started going, I think, when I was 15, 16. So you guys might have been a bit younger, maybe going, because I know Aaron's like 2.5 years younger than me, which is the same age as you.
Yeah, I think we started going like the Cats, wasn't it? And then to the Windsor then.
Yeah.
Yeah, what a place, amazing place. I just, didn't realize at the time, but I think, or probably did realize it, but I think even now you realize that actually there's not many spaces like that. People don't grow up with spaces like that today. So I think we were really lucky at the time to have that.
Yeah, definitely. So we've known each other a while, and actually, I wanted to let you know this. So when I was clearing out my office last week, I was going through all my drawers, and I got loads of photos and stuff. And do you remember? I think it may have been the first year that I got with Aaron, but we all went to Oakwood Park for his birthday. It was me
Right.
and the boys. It was like you, Rug, Cleet, and Aaron, and we went and Di, and I think Di was there, and we went to Oakwood Park. Do you remember?
I remember going to Ocular Park so many times with the boys. It was, we went through a space, I think, of doing that all the time. We used to love that.
But
We need to pencil in another trip to go again.
I found a photo of me, you, and Cleet on Vertigo. I'm gonna have to show you later. But it's hilarious.
Oh,
I'm
I think I
literally
remember being on Vertigo now, and now you say that with you guys. Where was everyone else?
well, I went on twice. So I went on with you, Cleet, and yeah, just you and Cleet. And then I went on again then with Aaron and Ruggs. And I've got the other photo of that as well, which I found was hilarious.
Yeah,
Um,
you love the theme park rides as well. You and Aaron have been to all the big ones as well, like Disneyland and things. So you're a
yeah,
pro at the rides.
I love it. Cool. So I've got,
You have to send me that photo.
I will.
Thanks for bringing that up. I thought it may have been some embarrassing one of me then, but that sounds
No,
like a fun, happy memory. So yeah, send it across.
I will. Um, so let's get into it then, Luke. So Dr. Luke Edwards.
No,
Um,
please don't call me
so we just want to talk about kind of your profession. So obviously you've already said that you're a training, I can never say this word, anaesthetist. Is that right?
Anaesthetist, yes.
Yeah.
I think it's got to be one of the hardest jobs to say.
I can say
Um,
anesthetics, that's fine, but it's the other word is I struggle with. I don't know
yeah,
why.
put in all the anaesthetist. Yeah, you can mess it up easily, can't you? It's hard. I'm sure I mess it up sometimes, especially when I'm tired. So I'm a anesthetic registrar, so like a trainee kind of. I'm 2 years away from being a consultant, and I currently work in London in one of the big trauma hospitals. And yeah, for anyone I'm sure everyone knows what anesthesia is, but it's basically helping people through operations, which is what people I think commonly know anaesthetists for when they go in for a surgery, and they might have to go to sleep or have something else. But also we do intensive care, so where we see the really sick people in the hospital. We do labour ward, so helping sort of pregnant women with epidurals or have C-sections and pain, things like this. We do pain clinics, like chronic pain clinics, and we are involved in sort of most of the emergencies and things like that in the hospital. Spend a lot of time in A&E. It's a really fun, exciting job. I love it, even at like 3 a.m. when I'm really tired. I love it.
Yeah, no, what you're doing is incredible. And I just wanted to say as well, so when Aaron and I was at your and Liv's wedding in September, the way that Liv spoke about you in her speech, and I think Georgie did as well, about when we were going through COVID, and how like incredible you were and how difficult it was. And I was literally a mess listening to those speeches because of how they spoke about you and about how passionate you are with your role, being a doctor. And I felt really proud to be one of your friends that day from how
Oh,
they were
thank
talking.
you. That means a lot, especially from coming like an absolutely amazing person and legend as you, as I'm sure we'll get on to talk about now in the podcast. But thank you, that means a lot.
You're welcome. Um, so how long have you been training, doing your training for?
So I did 5 years in medical school. I started in 2009, and that was in Exeter. And then I've been a doctor then since 2014, really. I've worked in Cardiff, Bridgend, and now London, yeah. With, like I say, a little bit of recent work overseas. So, yeah, 2 years left until I'm a consultant.
I bet you're looking forward to that.
Yeah, I mean, it comes with much more responsibility and yeah, other challenges, but then benefits as well. The pay will be better and perhaps less sort of less constant working at night and unsociable hours. We'll still have to do that, but yeah, benefits and some more challenges. So yeah.
Yeah, it's exciting though. One of the things I wanted to talk to you about today, which I wasn't aware that you were working at this specific hospital, but I think I'm not sure how long ago it was, but you worked in Moorfields, which is one of the is it the main eye hospital in London, or is it just a department within that hospital that specialises in the eyes?
Yeah, so yeah, I did. We move around a lot in our training to get kind of like different experiences in different hospitals, and I did a 3 month job in Moorfields Eye Hospital, which is in sort of east/central London. It's a really old building, an old hospital, so it's kind of its own entity, it's its own thing. London has a lot of these hospitals which like are specific to certain kind of parts of the body. They've got one for ear, nose, and throat, and for brain, and then they've got this one for eyes. And yeah, it's like it's one of the best hospitals in the world, and lots of the kind of like developments and discoveries and things like that and progresses have come from Moorfields because they're like such a specific hospital and they have loads and loads of people working in that sector, and they have lots and lots of patients come from all over the country. So yeah, they see all sort of problems, loads of patients, and it's a really busy hospital, yeah.
Because before I was diagnosed, when I went to Singleton first just to get like my scans and stuff after visiting the opticians, they did say actually that I was either going to be referred to Liverpool to St Paul's Eye Clinic, or I was going to be referred to Moorlands. Yeah, so it obviously is one of the, like you said, one of the best hospitals in the world to see, pardon the pun, by your eyes.
Yeah. So I mean, it's awesome that they give you that choice, right? So you can choose, like between either center based on what you read about it, or based on your own circumstances, like traveling distance and time and things like that. But yeah, I don't know much Liverpool, but from your experiences and from so that it seems like an amazing place. And yeah, Moorfields, I imagine, is similar, but just maybe in an older building.
Yeah. The eye hospital's actually moved to Liverpool now. It's like a brand new hospital. It's
Oh
not
wow.
just for the eyes, it's for everything. It is a bit of a maze, but yeah, it's brand new now.
But where is it in Liverpool exactly as well?
So it is in the city centre. It's not far. I mean, we walked from the hotel to the hospital in like 15 minutes.
Oh wow, okay, cool.
Yeah, so it's pretty much like not far out the centre. You can walk it easy.
Ah. And do you know what? I've actually never been to Liverpool. You enjoy going to the city and
Well, you know what? I'd never been to Liverpool until I had to go up to the hospital. Um,
hmm
but because obviously when we first started going up, we were in like lockdown and like obviously like couldn't do very much. And we have been up since. But when you have a baby or a young toddler as he's growing up now, it's kind of hard to kind of do like too much. But we do go around the town and see all the architecture. It's pretty amazing actually when you walk around. The architecture in Liverpool is really good.
awesome. Is it quite like old and kind of like industrial like?
Yeah, a lot of the buildings are like stone buildings, really fancy looking buildings. And
Oh
then you've
wow.
got like your typical kind of like town centre, shopping centre. No, it's good. A lot of people go there. The dock is really cool as well, down by the docks.
Cool.
And you get all the cruise ships coming in and yeah.
Nice. Cool.
So going back to Moorfields then, so I think we came to visit you. I can't remember if it's when we came recently and I found out that you worked in Moorlands and you'd seen the surgery that I had. I think it was, wasn't it?
Yeah, so I'd only been there recently. I think I was there from May, from March 2023 to February 2023 to May 2023, which was after like you diagnosed, had your treatment, etc. And he was doing like the follow-ups, yeah. So yeah, it's only a recent thing. And maybe subconsciously you sort of prompted me to choose to get some experience in eyes and eye anesthesia.
Yeah, because we came to visit you and live in London. It was in the summer, wasn't it? July, was it?
Yeah, it was starting to get hot as we found out in the race.
Yeah. So if you finished in May, you said, was it? Yeah, so you just come out of there. And I remember I think it was before we did the race. We did Race for Life in London Victoria Park, and it was awesome.
You know, I listened to the end of your podcast just now, the one in the episode just by yourself on Ocular Melanoma, and you were talking about the Race for Life, and I've just brought back nice memories. Really liked that, listening to that. Yeah, just the race was awesome. Doing it with Liv and Aaron, doing it with my wife and my best friend, and then just remember getting back to after crossing the finish line, and when you filled us in on everything that had happened, and you showed us the video, just how awesome that moment was, right?
Yeah, it was incredible. For anyone that doesn't know what we're talking about, so when the guys were doing the race, I kind of worked with Cancer Research UK last year, and they wanted to use my story as part of so before you do Race for Life, they kind of like G you up, don't they? And they kind of tell you why you're doing what you're doing it for. And they wanted to use my story to play to the participants before the race began. And before you guys went off, they didn't use my story. But then after you'd gone, I was on my own with Evan. And then they played my story over the speaker to all the participants that were taking part in the next lot of race. And yeah, it was incredible. Obviously, I was a crying mess. But then, like, a woman came up to me and she said, "Can I give you a hug?" And I said, "Yeah," because they obviously pointed me out in the crowd to say that I was actually there for that event. And then all these people started coming up and just hugging me, and it was like really emotional and it was overwhelming, but it was like incredible at the same time. And then I got to tell you all about it after you'd finished the race, and show you the video. So yeah, it was lush.
It was a pretty awesome moment, to like go through everything you've experienced and everything you've done afterwards, etc. But then to like travel to elsewhere in the country, like the other side of the country, and to have that played, and then to have just completely random people who have got nothing in common with, they don't know you, they live across the side of the country, coming up and giving you a hug and giving you good wishes and support and things like that is pretty. Seems like a really poignant moment, doesn't it? That seems like sort of come you're now like you've gone through it all, and the podcast, the work you do for Race for Life, the Maggies and things, you've now through your character, your awesome character, you've come out the other side, and you're now helping all these other people who may have gone through it or have family members, etc. So congrats to you.
Oh, thank you so much. But yeah, I think it kind of helps me process it and deal with it as well, knowing that like I've been through that, and then trying to help others then helps me deal with what I've gone through as well. It makes me feel kind of good about what I'm doing and like what's come from a really, really shitty time, worst time in my life, probably.
Yeah, I mean, like people have lots of different ways of kind of processing things and dealing with things, isn't it? And some are probably not very helpful. Things like bottling it all up and or turning to kind of like, unfortunately, probably some people turn to kind of like drink or substance abuse and things like that. But what you've done is turned it into something really positive, turned trauma into something really positive, and not just for you to help you process it, but to help other people, which to me seems like the best way to process something, or to manage something. So yeah, maybe not just telling people about your experience, but telling people how to, well, not telling people because everyone's different, but helping people to see a possibility of how they can kind of manage
Yeah.
difficulty and trauma and health problems. If people can see you as like an inspiration, how they can, not maybe not eye cancer specifically, but anything else, they can maybe try and model their approach on you. So yeah, in lots of different ways, what you're doing is amazing.
Oh, thanks, Luke. And going back to the Race for Life as well. That weekend that we came down with you and Liv, it was incredible. When we arrived, you guys were like, make yourself a home, what ours is yours. And I think sometimes a lot of people can say that, um, when you go and stay with people. But when we actually came to stay with you, it genuinely felt like it was our house. And obviously traveling with Evan, who is 2, and just not long turned 2, I guess, at that time. Obviously we were kind of a bit like not sure how he was going to be. But Evan, I found another photo as well the other day when I was clearing my phone of Evan sitting on your couch with like his arms behind his back, just like chilling. And when I saw it, I was like, yeah, he's definitely like at home. He feels like it's his home. So I just want to say massive thanks to you and Liv for that weekend, because it's definitely one that I'm not going to forget anytime soon.
Oh man, we can't wait to have you guys up again. Honestly, we loved having you guys. And we just like also like when you see some people and you think, oh, when we have kids, that's what we want to be like. I think when we saw how you and Aaron just were with Evan, just so chill, and is reflected in how he is as well. He's like the kind of chillest baby or toddler I've ever seen, and he's such kind of low key, etc. He's amazing, and how you are with him is awesome. But yeah, I loved having you guys up. Loved going to some of the restaurants we went to, doing the Race for Life, and just being in the park. Some perhaps less good parenting, so let's say, on some slides. Very wonderful husband, but I won't go into any more detail on that.
They were fine. They were fine. But yeah, I almost like had a heart attack, but they were fine. But yeah, I think I remember when we were walking back at some point back to your house, you'd said that you'd been working in Moorlands, in the eye
Yeah.
hospital, and then you'd said that you'd actually seen, or you'd been part of a surgery that was what I had experienced with my surgery. Um,
Yeah.
so how did you find that? Obviously, knowing that obviously this is what I've had, and like, were you quite interested in like, were you able to see what was happening, or?
Yeah, definitely. So, I mean, I loved my time in Moorfields. This is a truly amazing hospital with amazing people, and yeah, one of the beauties of the NHS. Although you might take a long time for other things, when you do need sort of care, you get like world beating, excellent care, and Moorfields is a good example of that. And I was just really interested when I got there, kind of to see the breadth of like everything they do. From like tiny babies to very elderly people, operations on everyone, and in between that age, from like cataract to kind of sight-threatening things in babies like glaucoma, to various other operations. And yeah, one of them was the ocular melanoma, or the eye cancer therapies. And then yeah, when I was first on a list doing that, I was really interested because I'd heard like your experience, but I didn't really know much about it and about kind of what they do, etc. And yeah, I found it really interesting to learn from the surgeons more about it, and yeah, more about maybe sort of what you were going through, and then obviously kind of learn how to do anesthesia for those cases, and then was able to kind of do those cases kind of independently then and things. And every time I did one, yeah, I'd always think of you. Um,
Oh.
which I think, yeah, maybe had a kind of softer spot for those patients because of you. But yeah, in terms of kind of what people were going through with the various different operations and different people you see, definitely this was, one of the like kind of most traumatic things that people can be going through or people were going through in that hospital,
Yeah. Were the patients, like the age of the patients, were they quite varied or were they of like kind of a similar generation or that you can remember? Just out of
So
curiosity.
it's just, yeah, I mean, it is variable, but it tends to be sort of like middle-aged people.
Is
I
it?
think the median age is 58 years.
Oh, okay. When
So
I was like middle age, I was like, I feel like I'm middle age. Maybe I'm not then.
no, you're not middle-aged. You're in the prime of your life. No, yeah, so sort of probably maybe most of the people I saw were kind of 45 to 70, kind of like that, which it probably fits with that fact of it, the median age being 58. So yeah, I think I didn't really see that many people as young as you, if any, from what I remember. So I think yeah, you were young
Yeah.
for that, but obviously it's a spectrum, and there'll be people on kind of the end of the spectrum who are having it younger or older than most people. Yeah.
Yeah.
Did you see that when you were kind of in the hospital, like looking at other people around you with the same thing, maybe?
So not so much when I was there for the day of like my surgery and things, but definitely in general when I go to the eye hospital, like generally it's a lot of like middle-aged, as you would say now, like 45 plus. I'm definitely like every time I go, I'm one, well, if not the youngest person um in the clinic. And it was
Yeah.
quite noticeable as well. Like I remember before I was diagnosed and I went to Singleton to go to the eye department there. I remember sitting there and obviously there was a lot of older people and like you could see them looking at me as if like, why is she here? That's how I kind
Yeah.
of felt, you know? Um,
Yeah.
yeah, yeah.
It must be tough as well to, yeah, like kind of feel, yeah, I don't know, did that throw up any kind of thoughts or whatever? Or, like, how does that
Um,
make you feel?
oh, you're turning it on me now. Um, I don't know. I kind of think obviously you do like when you are diagnosed with something like cancer, I think you do kind of first go to why me, like why,
Yeah.
I'm young, why? But then you think like after obviously after being diagnosed and going through what I've been through, you realize that like cancer affects one in two people. And when you say the word people, it's not just adults. It affects, unfortunately, children, babies, children, teenagers. Like it affects everybody.
Yeah.
So I think over time, my thoughts have obviously changed because I've had to adapt with what I've been given. And obviously,
Yeah.
yeah. Um,
I think like feelings of like, especially like why me, that must be pretty, like, especially considering you were pregnant at the time, like, that's the
mm,
big one, isn't it? Like why your first baby, like, you know, it's a nightmare thing to being told to go through, isn't it? So definitely, I can understand why you're feeling like that.
yeah. Um, yeah, it was a wild time. It does actually feel like such a long time ago now, though. But I can still
Yeah.
like vividly like see myself in that room and still like remember everything. Whereas if you ask me what I did like 2 days ago, or I wouldn't probably be able to remember. But yeah, vividly I can remember a lot over that time, even though it was 3 years ago now. Yeah.
Yeah. People with health, especially with health things, it's so like, yeah, it's so like, it's kind of always a big moment, and you, you're thinking about it a lot before the adrenaline's going through the time. You're thinking about it a lot after, so it kind of imprints itself on your memory a lot, doesn't it?
Yeah.
So yeah, I can understand that. But I mean, like another kind of way potentially to look at it is, I don't know how long these things take to grow, but like you were sort of young and you just went to get like a random routine eye test for no reason at all, and that you didn't have any symptoms, and
No.
you caught it really early, isn't it? So I mean, I don't know how long these things take, but if you'd have left it another, if you'd have been a bit older, maybe you weren't going for eye screening as often. Maybe it would have become symptomatic then, and then obviously like the risks are more
Yeah.
when that happens, isn't it?
Well, I had because it was a routine one. So I went in November 2020 and I had my reminder in the post probably like October. So I would have had my eye test in 2018, that time 2018.
Yeah,
So it's obviously
yeah.
developed within 2 years
Wow. Okay. So
because they obviously didn't see anything in 2018.
yeah,
So yeah, which is scary.
yeah. No, I liked your message in the podcast when you said to people, go get eye tests.
Oh yeah, I go on about it all the time, and I give people a rouse if they
Yeah,
say that they've never been for one and they don't need them because their vision is fine. But yeah, what's great now is that like a lot of people have obviously heard what I've had to say and tell my story, and I absolutely love it now when people tell me that they've been for their eye test and they've opted for the scan.
yeah.
And that's
Oh,
like,
nice, awesome.
and that's essentially the reason why I'm doing Rise Above Cancer, even if it's just to get people to, you know, check their bodies and do something about it if
Yeah,
something's not right.
and definitely at our age, like at our age, you kind of, which we're not middle aged, okay, we're young. If you tend to, you tend to take your health for granted, right? Like most of us, luckily, very luckily for us, have been healthy our whole lives. Maybe we've broken some bones and things like that, but yeah, you kind of take your health for granted at this age, and there are obviously lots of things. Health is a very like fickle thing, and we should all, yeah, be kind of feeling very lucky to be healthy for as long as we can during this time. And if you can do something to kind of check up on your body, then you should do it, right? Because you shouldn't take it for granted. You shouldn't worry about these things, but if you're offered like an eye screening or a dental checkup or another sort of checkup, then
It's
like
cervical cancer week
just
this
make a
week,
bit of effort. Yeah, exactly. So if
awareness
you're offered
week.
your smear,
Yeah,
definitely. So 100%, and that's like cervical cancer is definitely something that will affect women. Young women, and it will come out of nowhere. So if you can get the checkup and get the surveillance, you should do it, right?
exactly. Okay, so going back to the surgery, and I need to ask this question. I feel like it's going to be silly because Aaron keeps teasing me about it all the time. But he said to me that apparently they take my eyeball out to do the surgery. And I told him, don't be so stupid. Can you just clarify? Not for my sake, but for Aaron's sake.
So I don't know. Did he try and sneak in the theatre to see what they were doing, or has he been watching it on YouTube?
I
You can
don't
watch
know.
most operations on YouTube. So I'm not a surgeon, and I sort of I'm watching what they do, but I'm also trying to keep the person alive and keep them happy for the most part. So I'll watch as much as I can. But no, they don't tend to take the eye out. They usually use something called a speculum, like to keep it open,
Okay.
and to kind of like, and what they do is they will move the eye around by kind of attaching things to it, and they can move the eye themselves then to get wherever they need to go.
It's
I'll
so
have
weird,
to
isn't it? Like how they can do that. It's mad.
I'll try and find someone to ask for you.
Thanks. Yeah, let me know.
Maybe you should explain to people a bit. Maybe you should explain kind of like what surgery is for eye cancer.
Yeah, because I know there's obviously various different options because I was offered proton beam therapy as well. But because
Yeah,
of
yeah,
I was pregnant, obviously the thing like the plaque radiotherapy was like the quickest option for me because obviously I was heavily pregnant. Um,
yeah,
yeah. So those were the two options. Or the other option is obviously inoculation. Have you seen that?
yeah, yeah,
Oh,
yeah,
that's hard.
yeah. Yeah, it's sad, isn't it? Yeah, it's
Yeah.
pretty horrible thing. Yeah, yeah.
Yeah.
Yeah, with the plaque therapy, it's super interesting. I mean, like, I don't know, people will have probably heard you talk about it on the last podcast, but on the last episode, but it's basically inserting, it's called plaque radiotherapy or brachytherapy, and it's inserting like a metal plaque really about the size of like a 5p coin, but bigger or smaller depending on the size of the tumor. And they kind of locate that then over the tumor. It'll be kind of on the surface of the eyeball, and it'll be over the area of the tumor, which is inside between the retina and kind of the retina is the inside bit which has all the seeing cells, and then the outside bit is the sclera, which is kind of the white bit or the hard bit on the outside, and then the inside is the choroid, which is where the cancer is, within that middle bit. So the radiation from the disc will then kind of infiltrate, well, sort of pierce down into the area on the tumor. But they use a type of radiation that doesn't penetrate very far. So kind of has most of its effects on the tumor. Obviously, you can have kind of effects the other parts there, but it's limited, and it's mainly directed to the tumor. And then they'll do a calculation of how much radiation you need, and they're very hot on the timings about when the plaque has to
come out again.
Yeah. So you need enough time on so that it has maximal effect on the tumor, but as little time as possible there. Well, not too much time so that it damages the other structures in the eye. Yeah. It's amazing, and it's amazing surgery, right? Like it's eye saving, and I don't think you realize like how many problems there can be if you only have one eye. And like you say, not just the like kind of psychological thing of always thinking, what if something happens to this eye because it's your only seeing eye? So like eye saving surgery with sisters is pretty amazing.
That's something that I worry about as well. Like if for any reason, like my eyesight deteriorates, or if the cancer gets bigger and I have to have my eye removed, and then just having the one eye, that's something I think about probably too much. Yeah, it's tough.
Yeah, definitely. And like, like if something happens to the other eye when you're older from another disease or something like that, maybe, trying to adapt to like low vision in your kind of like when you're older, it must be so hard. So yeah, like saving the eye now through this type of surgery is pretty amazing.
Yeah, it's incredible. So obviously you did a couple of months in Moorfields and you saw various different kind of like eye specific surgeries. Have you obviously been part of any other like cancerous procedures or operations?
So yeah, I mean, I do all types of specialties now. So not just eyes, we kind of in other hospitals, I'll do all sorts of things, and always, cancer problems a large part of the workload. Cancers happen everywhere. They're just, they are, cells going wrong basically. Your cells are dividing all the time to replenish and re-go things, and if they mutate and they're not sort of like dealt with by the body's own defenses and they escape that, because the body is constantly telling kind of cells that might be abnormal to die and things like that, and they have control mechanisms. But if you escape that, if the cells mutate enough to escape those control mechanisms, then that's how you form a cancer. And that's why people can have like different cancers at different stages of life. It just is kind of luck and risk factors and genetics and exposure to harmful things that will cause that to happen in some people and at various times depending on the person. So we see cancers in lots of different specialties. I mean, you do a lot of sort of bowel cancers. That forms quite a big part of the workload. You'll see liver cancers, brain cancers, ear, nose, and throat cancers, like cancers kind of the tongue or the throat, gynecological cancers, so the cancers of kind of ovaries, uterus, lining of the cervix, this type of thing. So yeah, everywhere. And you often do things like sometimes kind of things for polyps, which might be cancerous. Sometimes you do things for screening. So yeah, and in all age groups really, from babies to elderly people. So yeah.
It's mad. Like, I think we spoke about this before. Like, as a doctor and like as part of your training and stuff, like it must be quite difficult. Well, it's probably more so in the beginning. To how would you like deal and process with like having, younger patients and just seeing like how do you process that?
I think you kind of develop a bit of a sort of your patients want like empathy from you, and they want you to kind of connect with them and to have time for them and to understand them and to understand what like their anxieties may be or what they might be worried about, and to have empathy for kind of what they're going through, especially with cancers, right? But they also like want you to you're there also to do a job, and
Yeah.
you're there to help them. And for me, it's like I meet people in a very limited time window of their disease. Like I'm meeting people, I've got to try and gain someone's trust and get to know somebody and figure somebody out, and kind of in like minutes where we meet them, and enough for someone to kind of be comfortable with you, put them off to sleep, be comfortable going to sleep, because you want someone to be as relaxed as possible and have the best experience. So you've got a lot of things to do in that time, and yeah, you only meet them for a very short time, like during the operation and when they wake up, in the like whole months or years long process of going through what they're going through.
Yeah.
So yeah, I think you have to remember that they kind of want a job from you, and they want you. For me, it's to keep them safe, to make them as comfortable as possible, and to have the best experience possible, and to kind of look out for them and their health. So I think if you kind of focus on what you need to do, that's that's helpful. And the more you see, you get like not hardened in terms of you're not like thinking about people, etc. But you develop like a harder skin. But you always see things that shock you every now and again. And I guess yeah, you just got to focus on the job you got to do then, right?
Yeah.
And especially like certain scenarios, especially with kids, are really difficult.
Yeah, I can't even
Um,
imagine.
yeah, like and they like anything with kids just generates like a big emotional response in you, isn't it? So and kids are really difficult, like because you've got the parents, you've got how they are feeling, like how they're behaving, this kind of thing. The child, the people around you might obviously be shocked by something. But people often look at you to like be in control of the situation and need. So sometimes you've got to kind of park those thoughts, but then you think about them after, and like often like for a very long time.
That's
Depending on
probably
what
the
you see.
worst bit, isn't it? It's not probably not so much because you've got to go in, you've got to do a job, you've got to do a good job, you've got to make sure they're safe. Like you said, it's probably afterwards for you, is it? That is the
Yeah,
harder
like
bit, like.
yeah, definitely. I think it's good in the hospital you have like camaraderie with like your colleagues, and you can often talk about situations after, and there's good support with like more senior people you can talk to all the time. But and then it's good to have like support network with your partner or your family when you come back. But then sometimes yeah, you just sometimes all this kind of stuff. Yeah, you might think about it at random times. Obviously, more so immediately after the thing, but sometimes after months, etc., even years. But yeah, I lost my train of thought then. But
Sorry, I've probably put you
I
completely.
know, no. And sometimes like you got it. Sometimes you just get like, especially after COVID. I remember I just was really burnt out, and I didn't have like much kind of like ability to your like coping mechanisms and your like ability to deal with things is just like very reduced, and that's the product of the stresses and the things you've seen as well, right? Like I saw like pretty horrendous things all the time, like every day and every night in COVID. And although I didn't think they were getting to me, I think is reflected on just like how burnt out I was after it happened. Uh, so yeah, you think about experiences, but also they just have like a general effect on your well-being as well sometimes.
Yeah. I'm in awe of you, Luke. Like what you do is absolutely incredible and not obviously not a lot of people could probably do what you guys do in the NHS, and it's yeah, it's amazing.
You should thank the nurses. The nurses are far more amazing than the doctors. The nurses have to
Oh,
put up with so much more stuff than us. So yeah, I should thank mostly the nurses.
no,
But you're also amazing,
very
Emma.
humble.
No, what you've done is honestly incredible. I would never be organized enough and have the like. I might think it might be a good idea, but if I had thought to do a podcast, I would. I think there's like a 0.3% chance of me ever having been organized enough to do it, let alone to have a killer theme tune and a logo registered as Spotify.
Oh, thanks. Anyone can start a podcast. That was told to me by my coach. Yeah, anyone. You could literally do it on your phone. You can do it like on your break in work, or you can no, don't do it on your break in work. You could do it like anytime. Um, yeah, I think everyone has value in what, they have to say, and even just from what you've said so far in this podcast, you have a lot of value and a lot of amazing and incredible experiences you can share. So, yeah, if you are interested, start a podcast.
Thanks, babe.
Is there anything that you wanted to talk about?
No, I don't know what like would any of the listeners like to know about kind of anesthesia for the about for that kind of eye surgery. I feel like I've not really talked about anesthesia, or I could be a fraud here for all anyone knows.
Oh, shut up. No, well, we can talk about anaesthetics in pregnancy because I know we've spoken about that before, and I thought it might be quite
Yeah,
interesting because obviously you
yeah.
probably know a lot more about that than me, even though I was the one that had it. But yeah.
Often patients know a huge amount. So don't put yourself down. But you're actually the one who's going through it and reading up about it all. So we can work through this together.
Um, okay. So obviously there is a lot more risk, isn't there, when someone's pregnant with having anesthetics.
Yeah.
Um, would you say, like, have you ever had to, obviously you've had to do that, haven't you, with pregnant ladies?
Yeah, so pregnant women can require anesthesia for kind of like pregnancy related reasons, like obstetric reasons, we call it. So they might need anesthesia for a cervical stitch during the pregnancy, cervical suture during the pregnancy, or at the end of the pregnancy for C-section or for pain relief with an epidural. So they might need it for that type of reason, or they might need it for like non-pregnancy related reasons. And those can be like planned or non-planned. So like a non-planned reason would be, as you experienced, like for an eye cancer, that the risk is if you leave it go, then it is more likely to grow and to spread elsewhere. And you have to balance that, against how pregnant the woman is and when is how long you could leave it until after the pregnancy, or do you need to do it now? So yeah, that's really difficult because you could have kind of a more like immediately urgent reason, like appendicitis, for example. Like pregnant women can still get
That's mad.
appendicitis, and that's not something you can really kind of like leave, right? Or they might
No.
have an abscess somewhere or something. So there's lots of like other reasons why someone might need an operation kind of more immediately. They can't really be put off. And yeah, the risks depend on how far into the pregnancy the woman is, and the risks differ throughout the pregnancy.
Hmm. It's
So like
interesting.
early on kind of thing, early on, like when the fetus is developing, you obviously
Mhm.
have risks to the kind of development of the fetus. And that's in terms of like forming the organs, but also just, kind of risk of miscarriage and things like that. And there are certain things that are a risk to the fetus, and like certain kind of drugs and kind of other things like having enough oxygen, having a good blood pressure, not being too cold or too warm, that all are really relevant under anesthesia. So So they come into play kind of like early on, and then as time goes on, then the risk of miscarriages kind of is still there. But then as time goes on further, you start to get the changes in the mother, which provide risks to anesthesia. So, like your body, because you've been through, your body goes through a lot of changes when you're pregnant. That for us, trying to guide someone safely through an anesthetic is really challenging. Like, there's changes in your breathing, your circulation, kind of your airway, your tract down to your lungs. People might be sick or feel sick or be being sick. People are more likely to regurgitate and aspirate. You have to do certain positions to kind of like keep the pressure off, the blood vessel supplying the baby, etc. So and there's loads more changes. So yeah, there's like different considerations as you go through pregnancy.
So what you said about checking the oxygen levels, whether they're hot or cold. Is that all of your responsibility as well? Not just like obviously putting them to sleep, as people say.
Yeah. So like this. Yeah. So I mean, anesthesia can be asleep or not asleep, and if you can avoid putting someone to sleep, then that could be a really good option as well. Especially in a pregnant lady, right? If you can use a kind of another type of anesthesia, like a spinal anesthesia or a nerve block or something like this, and you avoid putting someone off to sleep. But if they are asleep, or if they need to go to sleep, or they've chosen to go to sleep, then basically anesthesia is all these things. It's just keeping everything normal, or to certain degrees or like kind of appropriate degrees of acceptance when someone is asleep. And it's just we do A, B, C, D, E really. That's like our mnemonic. So we protect someone's airway, so the sort of the tract down to their lungs. We control people's try and make sure breathing is normal, so oxygen levels and carbon dioxide levels. We make sure people's circulation is good, so blood pressure, heart rate, and we make sure people are asleep, free of pain. Sometimes if they, not moving potentially as well, and then E for temperature, and make sure people's sort of exposure, we call it, which is temperature and positioning, and kind of making sure there's no pressure on certain bits, etc. But yeah, so we do all these things. It's just maintaining normality really, and then waking someone up safely again.
Yeah, it's mad. Like when I think about so obviously I've had two different types of anesthetics. So when I had my surgery, I was obviously completely under. So I was, is it unconscious the right word? What?
Yeah.
Yeah. And like I remember, like before I went in, I remember it was literally I was just having a chat with somebody. Obviously, you can't tell who's who because everyone's got like masks on. There's loads of people around you. And I remember somebody saying to me, oh, so if you weren't here right now and you could go anywhere in the world, where would you go? And I was like, Walt Disney World. And then literally, I was just having a conversation with somebody and then I was just asleep. It was so wild. It was so bizarre. And
It's a strange feeling, isn't it?
Yeah. And then I remember waking up, and I can't remember if it was the first time or after my second op. And you said about regurgitating and being sick. I remember waking up and like I was basically choking because I needed to be sick. Yeah,
Oh.
yeah, it was not nice. And I was sick quite a lot, I think, after. I think it must have been the first time. But because I was pregnant as well, and I was already suffering with really bad sickness during the pregnancy, it just felt like worse.
Yeah, definitely.
Yeah.
That's one of the big things we try and avoid in anesthesia. It's called post-operative nausea and vomiting. So it's pretty.
Well, I definitely had that.
Yeah, it's patients kind of one of their top things that they don't like, understandably, after waking up. So yeah, we try to do the anesthesia in a way that minimizes that, and then often that means giving some preventative kind of anti-sickness medicines and things while people are asleep. But in your case, if if you're pregnant, you're much higher risk anyway. Anesthesia kind of makes, we know that it makes you feel sick. It's certain types more than others, certain drugs more than others. And if you're already sick anyway, then it's like, yeah, the chances are unfortunately really high. And sometimes you're limited with the drugs you can use as well in pregnancy to treat. So I'm sorry, it's pretty horrible when yeah. I
Yeah.
haven't experienced it myself. I've had an anaesthetics. I haven't experienced it myself, but when experience yeah, it's not nice.
No. But on the other hand, then, so when I had my C-section, like, and it's wild to think about it now. So I was more nervous having the spinal injections
Yeah,
than I was for the entire, like, even, yeah, the surgery, like beforehand. I was more scared of having that injection in the spine than anything else. And I remember
yeah,
being so nervous about it. I remember like literally like shaking sitting on the edge of the bed. Um, and it was actually nothing. Like it was so painless, and I just worried myself over nothing. And as soon as that first injection, because I think they do two, didn't it? They do one to numb the area, and then they do the
yeah,
second one, didn't they? So after
yeah,
the first one, I was like, oh, this is fine. And then they did the second, and honestly couldn't feel a thing. It was the best. And
yeah,
I absolutely, like, I know it sounds weird, and I've said it before. I really thoroughly enjoyed Evan's birth. It was incredible, and everyone obviously in the room at the time, the anaesthetist was amazing. I think I remember telling you at one point, he was like, "Are you okay?" And I was like, "Yeah, I'm fine. I'm just chilling." And he was like, "You're being too chill." And he had to give me something to like pick my heart rate up because I was just too relaxed. And I think I told you before, like when Evan was born and they showed me him, I remember like trying to cry and there was nothing coming out my eyes. It was like the weirdest thing. And I think you said it was whatever they'd given me to kind of pick my heart rate, but I just physically couldn't show any emotion. It was really weird.
yeah. There's a lot of things going on during that time,
Yeah.
isn't it? Everyone says yeah, it's really weird. First of all, like I mean, the whole thing you're going through during that time is so like overwhelming, isn't it, during pregnancy, especially if it's like an unplanned event. If you're having
Yeah.
like a C-section or something as an emergency,
Yeah.
it's and like my favorite thing that somebody said once was you know, I was going to say, like, and then if you have, you know, there's lots of people in the room, people are getting stuff ready, it's lots of noise, you're in a completely different environment, you've never been in there before, you're having a very strange procedure done to you that you get really worried about. People get really worried about the needle, but as you say, you know, it's pretty tolerable and
Yeah.
fine. But then you have this weird feeling that you can't feel your legs or move your legs
Yeah.
and all the sort of strange things that are happening then during the time of, you know, everything that's happening during the operation is all pretty overwhelming. And one of the favorite things I think somebody said to me was, "This is a lot, isn't it?" I was like, "Yes, yeah, yes, it is a
Yeah.
lot." I can't imagine.
C-sections, they cut, is it through 8 layers they have to cut through to get to the baby? And it's like the most layers that that has to be cut to get through, which I found was really interesting, like in operations and procedures.
Yeah, I mean, they have to get through skin, kind of like the subcutaneous tissue, the muscle, and then they have to arrive into the abdominal cavity through the peritoneum, it's called, and then you know, then you have the uterus. You have to go through the womb, and the different layers of that, and then until you eventually get
Get
down
to
to the
the
kind of the
baby.
sac, and then yeah, once you're through that, the baby's there. So
Yeah.
yeah. Amy, you sound like you know so much. You could probably apply for a job.
You know what?
I might be out of a job soon.
My mate Caitlin, she was like, "You could be a nurse," and my grandfather was like, "Amy, you could be a nurse," and I'm like, "Oh, I don't know if I could do it. I don't know, injecting
I
people
think you
and
could do it. I
taking
think you'd be
blood and."
I think you'd be amazing, like colleague in hospital to have so many different
uh,
roles. It's not enough to. You can do many things. Yeah, you could even be a volunteer as well. Come in and sort of,
have a
you
look.
know, Well, yeah, well,
Have a
as
go.
well as being nosy, you could help the people and help the patients as well. Because you
Yeah.
have lots of volunteers in Moorfields, like lots of like people who have been through things and might come in and kind of sit with people, talk with them, or even like hold their hand during a surgery,
No.
which are like super helpful. So yeah, there's always like room for volunteers as well if I can convince you to get involved in hospital things.
Something to think about.
Maybe you're too busy with the podcast, but you're very
Um,
organized. I'm sure you could do it.
yeah. So one thing I wanted to ask as well, which I did speak to you about before, and I promise I'm not putting him on the spot, everyone. Um, so how does being a doctor affect you personally? Like when you have loved ones that have been diagnosed or are going through like a serious illness, like how do you process and cope with that? And like how do you differentiate between like your doctor brain, which obviously we've talked about, where you kind of like get all those skills through your training, and how do you process it when it's kind of more close to home than what you see in a hospital?
Yeah, I think it's really difficult, isn't it? Because yeah, you kind of you're in your own environment, you're in your work environment, you're kind of it's hard to not kind of engage that part of your brain. That's like your work brain, like your as you call it, your doctor brain. Um, I think, yeah, I mean, I think it's all like I think I feel very like privileged to kind of work in healthcare, same as my sister Chelsea and my two cousins Emily and Katie as well. When you because healthcare, like the system is really hard to navigate, like for people, and it's very unfamiliar. And if you work within that system, then you can. I think one of the like things you should be happy about is that you can help your family members to navigate the system. So like to tell them, explain things to them, because also sometimes you spend like 2 minutes with a doctor or anything, and people, especially if they're going through things, they completely forget everything that they've been told. So if
Yeah,
you
I
can
get
kind of
that.
like, yeah, like if you can you can be a big help to them if you can kind of just explain things to them, explain what they're going through, what might be happening, kind of paint the picture of things to them. But also you can then act as like their advocate, so you can not check that everything is going right, but kind of make sure that the person has been offered all kind of options and things like this, and just to kind of be their advocate, like, and because often people are really busy, and if you see something or you want to check up on something, you could do that, which I feel grateful for sometimes. But then people can obviously be really overbearing. I've seen like kind of medical family members of people, and you can also like cause difficulties in the way you're behaving as well. So I think you need to think carefully about how you like behave in that circumstance. If you're with a family member or a friend or relative or something, you just try and be of help to them and not kind of pose difficulty to the staff treating them. But so then I think it's good in that way that you can help with all those things. But I think also you need to kind of at times just then be like a person, right? And like
Yeah.
kind of like because otherwise you'll, as you say, you'll all the stress and trauma will come out in some other weird way. So I think you need to allow yourself time to do that as well, and to feel like a person and a kind of a relative of a loved one. And my grandfather had bowel cancer as well is what he died of, and before that brain cancer, and I think he also had prostate cancer. So he's
Bloody hell.
pretty unlucky, and all those different things took toll on him. But that was kind of, I think, when I was in the end of medical school, I started working, and yeah, I tried to kind of that was helpful for my mother to kind of explain things because she was with him a lot. And that was kind of helpful to talk things through, I think, from my mother's point of view. But then, yeah, you've got to kind of allow yourself to get kind of to feel everything, right? As well. So I
Yeah.
remember, yeah, being upset when like you come home from the hospital or the hospice and things like this.
Mm.
But luckily, yeah, since then, my family have been healthy. So yeah, yeah. But that's a really good question.
Yeah.
Um,
I'm glad as well that you take the time switch your doctor brain off. It's probably not the best term, but like to actually like experience, you know, and feel your emotions and yeah.
Yeah, it's hard sometimes because people are always looking to you for kind of answers or kind of advice and things like that, isn't it? And
And you probably feel that
um,
pressure as well to
yeah, a
yeah.
little bit, yeah. And also like medicine is so vast. Uh, and the more I do like a specialist thing like anesthesia, the less I know about other things. Like you can only hold a very like a certain amount in your brain. So sometimes as well, you feel like maybe that you should know more about something than than you do because it's a long time since you saw it or covered it or treated it. So
And things
yeah,
change
that's
all the time,
sometimes
don't
hard as
they?
well.
And new research and new ways of doing things and trying to keep up
Yeah,
with
exactly.
yeah.
And that's why like I think like when you with your family members with specialists, you can be kind of like an advocate, but just ask like you know I appreciate that you kind of won't know as much as the person you're talking to, but you can help them by asking like help your family member by just explaining things or asking kind of like more basic questions, you know, like that kind of thing.
Yeah. Well, thank you for sharing that with me. I think it is really important to kind of, like I said, to feel your feelings and to, because at the end of the day, you aren't a doctor well, I don't know if you feel like you're a doctor 24/7 or whether you can find that time to kind of switch off and just be like, God, you know, don't know if I'm putting words in your mouth.
Yeah, no, no, I can't. I think it's good. You've got to have a good like support network around you, isn't it? Like you found with
Yeah.
Aaron, right? Like he's
Yeah, 100%.
has been an absolute like amazing husband and support kind of network for you as well as your family, I'm sure. But I know he's an absolute legend. So, and he hasn't paid me to say this, but I know he was absolutely amazing to you, as he is an amazing father. So yeah, Liv like that with me. You know, she's an amazing support person. I can come over and talk to her about anything, and she'll make time to talk to me about that. So that's really important, isn't it? And like you say, like what you found good like supporting information from charities and things like that. And yeah, what you're doing now is amazing because you're also putting more information out there and supporting people. Like in your podcast, I found it interesting when you were talking about the person who contacted you because their husband was going
Yeah.
through the same thing, and then there's information out there, but to hear it like a personal experience of it, like someone who's gone through that pathway is must be like super helpful for everyone.
Oh, thank you.
So, I realize I've talked a lot there, so
Yeah.
I know we're coming towards the end, but I wrote down some questions that I want to ask you. Um,
Oh
I'll try and
gosh.
keep it short because your listeners are probably growing old and cobwebs everywhere now.
Oh, I don't think so.
First question. So, I was interested to ask people: is there anything that anaesthetists or other doctors or nurses or anyone else in healthcare do that are kind of not very helpful or kind of funny or like helpful? Do you remember anything that people said or did?
Oh, it's a difficult question. I think my experience with the anaesthetists, I think they were incredible in both, well, three scenarios because I ended up having three surgeries in the space of 2 months. Um, yeah, they were incredible. Um, I think the only thing I would probably say is after I had my surgery up in Liverpool and obviously having to kind of deal and go through all of that, I think it was like afterwards. So I had loads of information even before I was diagnosed sent to me about like what it could be and like the processes and the operations, the procedures that were available. All that was brilliant. It was brilliant, obviously, through my diagnosis and everything that they put in place. And I think for me, it was the afterwards that probably could be improved. So I was offered because obviously we were still in COVID, I was offered a phone call with a psychologist. And I said, yeah, okay, I'll go for it. And it was a very strange experience. I don't know if it was because it was just over the phone or, but I felt like afterwards, like that was it then until I had my 6 months check. There was kind of nothing in between. And
Yeah.
I wasn't kind of like pointing into the right direction to get like the support that I probably would have needed. I didn't think I probably did at the time, I guess. But yeah, I think that for me, I think is what could do with being improved.
Yeah, the aftercare definitely, because yeah, I'd agree that I've seen that. Did any other kind of organizations like charities or anything like that fill that gap or that void? No.
Not until I spoke to my health visitor after Evan was born, when I think it was after I'd been for my 6 months checkup, and obviously I was expecting to go to Liverpool and be told, yeah, the cancer's gone, you're cancer free. And obviously that's not what
Yeah,
happened. And
yeah,
then I really struggled with that in the beginning. And when I was taking Evan to have a checkup, it may be in his injections, I can't remember now. And I spoke to a health visitor, and luckily enough, her sister works in Maggie's, and that's how I
yeah.
ended up then going there. So up until that point, I didn't have any like anything offered to me or like pointing me in the right direction.
Mm. Yeah, I think we can be better at that, isn't there? I don't know how to improve that, but yeah, there's lots of help for people around, but we're not very good at pointing towards it, I think, isn't it?
Yeah, and I think like because I was pregnant as well, like I didn't even realize until like last year that there's a charity called Mummy Star, and it's specifically for um women that have either you know not long after having a baby, giving birth, whether they've found out they've got cancer while they're pregnant. And I wish I kind of at the time I had known about these um that charity just to kind of get support from them at that time. Uh, so that would have been
Yeah.
good to know. But again, because of the whole COVID thing, I don't know if that is the reason why I didn't. Because obviously everything was a bit up in the air at that time.
Mm. I think I definitely, I would agree we can be better at that. So I think it's good for me to know for the future. And then my last question was going to be, so what plans have you got for the future for the podcast or for Rise Above Cancer? So I
Oh,
put you on the spot a bit with this one because I didn't tell you I was going to ask this, but I'm
um,
excited to know.
okay. So hopefully more podcast episodes. Ideally, I'd like to speak more with guests. I think like having this conversation with you today has been great because I think when I've recorded on my own, like you don't have anyone to bounce back off. So it can be quite like difficult in that way. Whereas when you're with somebody, you get obviously get the value that they bring to the conversation, as well as that little bit of like breathing time when obviously they're having their say, so it's kind of like back and forth rather than just
Yeah.
focus. So I think having guests on, um, hopefully I could get somebody from maybe Maggie's that I can speak to, which I think would be quite interesting. And maybe
Mm.
other people that I know that may have been affected by cancer themselves to kind of get someone else's perspective on things. And yeah, so with the podcast, that's kind of where I'm at. Also trying to do other episodes by myself. Um, yeah, so that's kind of with the podcast. And then other stuff then. I haven't actually talked about this, I don't think, on the podcast yet, but basically next month I am going to Maggie's and I'm being interviewed for an article. I think it's to do with the postcode lottery because they've just given loads of funding to Maggie's. And they wanted to, obviously, with Maggie's as well, like there's loads of different storytellers. That's what they call us. Um, but they've specifically like chosen my story out of them all to like be part of the campaign. So I'm meeting with somebody next month, a journalist to obviously kind of have an interview with them and a photography session and all that jazz. So that's happening next month, which is pretty
Oh, yeah,
exciting.
that's very exciting. Yeah, that's so exciting. Well, I think like your that's why your story is so interesting and helpful to people because you got 2 points of difference, right? Like you've you've experienced eye cancer in itself is really rare, and there's not many people who go through it. So like all the information that you provide people on that is really helpful. But then also kind of having cancer while you're pregnant, having surgery and anesthesia while you're pregnant is not something many people go through in and of themselves. And combining those two things, I think your experience is pretty harrowing and pretty interesting to anyone who reads. So yeah, that's why I love speaking to you about it. I love hearing, and you're such a good you're such an amazing kind of like specialist in your experience, and so much, and you speak about it really well. You speak about it like in a super personal way. So yeah, anyone listening to this or reading about your story will be super interested.
That's really kind. I'm not going to cry. Yeah, and then other stuff. I'm going to move on from that before I start. But yeah, other stuff this year. We have, so again, can't believe that this was even asked, but basically earlier on, well, this year, end of last year, I was like, right, this year I want to do a fundraiser, but I want to put on like a gig, and like for charity. And literally, like a couple of weeks ago, a band called Shell, shout out to Dawes, Aaron's mate, who he kind of works with in Admiral, basically asked if I wanted to go to their release show, which is happening in March, just to go to kind of have like a little table and sell like the zines and stuff that I've created, and just like talk to people about cancer, which alone I was kind of like blown away about. And then literally Aaron was like, yeah, she'll definitely be there, it'll be great. And then the next day they were like, so we've spoken to all the bands that are playing, and we've decided that 100% of the proceeds from the entire show is going to go to you, and you can donate it to wherever charity you want. And
wow, that's amazing.
I know. So
what a bunch of legends.
I know. So all the money that is going to be raised at the gig is going to go to Maggie's. Yeah, and it's mad because like I said that I wanted to do that this year, and I don't know if this is a bit of a get out, but like I don't have to do anything. It's already arranged, it's already organized. They put my logo on the flyer, which I'm super grateful for. And yeah, like it's happening, I've said what I wanted to do and it's already happening without like, yeah.
Oh, that sounds amazing. You have to tell me when it is, I'll come back for it.
It's March the 2nd or 3rd. It's a Saturday. I don't know if are you back from South Africa then?
I am actually planning on coming home that weekend, so I'll be there. Can't wait. Yeah.
Plane straight into Cardiff. I doubt that it'll go into Cardiff, but yeah.
I'm back beginning of Feb, so I'm coming back to Wales the beginning of March, so I can't wait to go to your to the gig. It'll be awesome.
Oh, amazing. Yeah,
I'll have to spend lots of money on the bar or something.
Yeah, there's a few things happening. But yeah, because of obviously I am a mum and I have a job, and like Rise Above Cancer for me is something that ideally in a couple of years' time maybe I would want to do full time, but at the moment I'm just going with it and just doing stuff and just seeing kind of what happens. I think sometimes if I put too much pressure on myself, then I'm probably like the least active, is that the right word? I think it's just better just to kind of go with the flow and yeah, not too much pressure, have fun, raise awareness, raise some money. Yeah. That's not my tagline.
You're doing an amazing job at it, so keep going.
Oh, thank you so much. So I think that is bringing us to an end now. So thank you so, so much, Luke, for coming on and having a chat with me. It's been an absolute blast and you've been incredible.
Oh, thanks, Aimée. It's been a pleasure to come on the podcast. Anything to support you, and I'm so in awe of what you're doing, and it's super helpful. So keep on going. And if anyone wants to ask me any questions about anesthesia or anything like that, or anything about what I said, just give Aimée a message. She can forward it on to me. I'm terrible on social, so as you know, so message Aimée. Always happy to answer any questions.
before you go, and this is going to be sneaky because I haven't said about this to you, so it's going to be on the spot. I want your first answer. So at the end of every episode, I play a song. So I want you to pick the song for the end of this episode. So no pressure. First thing that comes to your mind, go.
Okay. I think play Fiddlehead Sullen Boy.
Awesome. Well,
There
thank
is
you.
actually a song by Ed Shikari called The Anaesthetics, so maybe you should play that one.
Maybe I'll add that on the end as well. Okay, I'll do that too. So there'll be 2 songs. Well, thank you so much again, Luke. Together we can rise above cancer.